Hello guys, today we will study about COVID-19. We will study about its symptoms, its causes, its management, treatment and preventions. First of all, we will study about what is COVID-19. COVID-19 is also called as coronavirus because it has crown-like spikes. Coronavirus is the family of viruses that can cause respiratory illness in humans. Its new strain SARS-CoV-2 was first reported in Wuhan, China in December 2019. Now we will study where do coronavirus came from. So guys, these viruses are found mainly in bats, cats and camels. They don't infect these animals. Sometimes they transfer to other animals. These viruses can jump from animal species and begin to infect humans. COVID-19 virus can enter your body through your mouth, nose and eyes directly from airborne droplets or from the transfer of virus from your hands to your face. It then travels to the back of your nasal passage and mucous membrane in back of your throat. It attaches to cell there and begin to multiply and moves into lung tissue. From there, virus can spread to other body tissues. The new strain of COVID-19 travel in respiratory droplets released into air when an infected person coughs, sneezes, talks, sings, or breathes near you. You may be infected if you inhale these droplets. You can also get coronavirus from close contact by touching, by shaking hands with an infected person and then touching your face. Person at greatest risk of contracting COVID-19 include who live or have recently traveled to any area with ongoing active spread. The person who had close contact with the person who has a laboratory confirmed or suspected case of COVID 19. Close contact is defined as being within 6 feet of an infected person for a total of 15 minutes or more than 24 hours. The person who is more than 60 years is also a weakest immunocompromised person, so he is more prone to infection. Now we will study what are the symptoms of COVID-19. COVID-19 symptoms vary from person to person. In fact, some infected people don't develop any symptoms. They are asymptomatic. In general, people with COVID-19 report these symptoms. They are fever, chills, cough, shortness of breath, or difficulty in breathing. They had tiredness, they had body muscle or body itches, they had headache, and they lost their taste and smell, they lost their appetite, they had sore throat, they had congestion or runny nose, they also had nausea or vomiting and diarrhea. These are the symptoms mainly shown in infected person, and some additional symptoms are also possible with person to person. Symptom may appear 2 to 14 days after exposure to the virus. Children have similar but usually milder symptoms than adults, and older adults are more prone to infection and show more severe symptoms because they are totally immunocompromised. So if you had some of these symptoms, you should contact your physician. If you had trouble of breathing, if you had persistent pain or pressure in your chest, if you have inability to wake up from sleep, if you have bluish lips or face, you should consult your physician. COVID 19 is diagnosed with the laboratory test. Your healthcare provider may collect a sample of your saliva or swab from your nose or throat to send for testing. If you tested positive for COVID 19, you should quarantine for 5 days. If you haven't fully vaccinated or you have a more than 6 month by since you have second dose, you should quarantine for more than 5 days. And treatment of COVID-19 vary from severity of your symptom, vary for every person according to his symptoms. Depending on the severity of your COVID-19 symptom, you may need supplementary oxygen given through tubing inserted in your nostrils, as we say tubal insertion. Or some people may benefit from an infusion of monoclonal antibodies. Antiviral medication may reduce the risk of hospitalization and death in certain patients with COVID 19. Mechanical ventilation, oxygen through a tube insertion down to your trachea. You are given medication to keep you comfortable and sleepy as long as you receiving oxygen through a ventilator. And at the end, extracorporeal membrane oxygenation ECMO that should be continued to receive treatment while a machine pumps your blood outside your body. It takes over the function of your body's lungs and heart. And the best treatment is vaccination of COVID 19. You should vaccinate yourself and your family from COVID 19 to save the others from this infection. And now we will study about prevention of COVID 19. The best defense to prevent getting COVID 19 is also vaccination. You should also follow some steps to prevent other from this virus, such as common cold, flu. And the prevention method are: wash your hands for at least 20 seconds, especially before eating and preparing food, after using washroom, after wiping your nose, and after coming in contact with some person who has cold. And wear a multi-layer cloth face mask that fits snugly on your face and covers your mouth, nose, and chin as recommended by CDC. Avoid touching your eyes, nose, and mouth to prevent the spread of virus from your hands. Cover your mouth and nose with the tissue when sneezing and coughing, or sneeze and cough into your sleeve. Throw the tissue in trash. Wash your hands afterward. Never cough or sneeze into your hands. You should avoid close contact within 6 feet with those who have cough, cold, or sick. Stay home if you are sick. If you are prone to sickness or you are immunocompromised person, you should stay away from large crowd of people. Follow the directions of your healthcare authorities, especially during these recent breakdowns. Clean frequently used surface such as doorknobs and countertops with the virus killing disinfectant. Use hand sanitizer that should contain at least 60% alcohol if soap and water are not available. Greet people with a friendly gesture instead of shaking hands. Avoid shaking hands. Get enough sleep. Eat a healthy diet. Drink plenty of liquid and exercise if you are able. These steps will make you a strong immune person and help you to fight off infection more easily. And according to CDC recommendation, you should self isolate until you have met these following criteria. If you had positive test for COVID-19, it's been 5 days since your symptoms first appeared and your symptoms are improving. You have not had a fever for 24 hours and you have not used fever following medication during this method. While at home, self isolate within a separate room of your home if possible to limit interaction with other family members. If you can't stay yourself 100% isolated in a separate room, keep at least 6 feet away from others and wear a cloth mask. Wash your hands and family members' hands often and frequent. You don't need to be retested after your period of self isolation, but every case is unique, so follow your healthcare provider's recommendation for testing. And if you are a immunocompromised person and you show severe symptoms, then you should stay home for up to 20 days after your symptoms first appeared. And you should recommend to your healthcare provider about your situation. If you are in an area with high community level of COVID-19, wear a face mask. It is compulsory for you to wear a face mask. And if you are sick but can't avoid being around others, you should also wear a face mask. If you are carrying someone who has COVID-19 and if you are at high risk of severe illness or live with someone who is positive for COVID-19, you should wear face mask to avoid this infection. So these are the some preventive measure of COVID-19, and this is all discussion about COVID-19. But at the end, I should say that these changes we have all made to stay safe and healthy can be feel challenging, but please stay vigilant. We know it's not easy, but it's critical. COVID-19 shouldn't be taken lightly. Some people get only mild symptoms, but other develop serious complications like lung, brain, and heart. There may also be other long term effects of COVID-19 that we don't yet know. So we should keep ourselves away from infected person and follow these preventive measures to avoid spread of this infection. COVID-19 is a hot topic of recent times, and we had a pandemic situation in recent era. So every person have some knowledge about COVID-19 and its symptoms and its causes. By this information, you people know a detailed knowledge of COVID-19, its symptoms, its causes, its preventive measurements, its treatment. So, guys, this is all about COVID-19. I hope you people get some knowledge and it will help to tackle this situation for near future and to restrain the spread of this virus. So guys, thank you so much, and that's all.